Welcome to Health Systems Innovation Lab Hackathon, Building High-Value Health Systems Through AI. My name is Dr. Rifat Atun. I'm Professor of Global Health Systems at Harvard University and Director of the Health System Innovation Lab. I'm going to share a presentation with you on how AI can enable transformation of health systems in order to address the major challenges that systems face and build high-value health systems. So what is happening in health systems? Why is there a major challenge that needs overcoming? Well, first of all, before identifying what the major challenges are, we need to understand what a health system is and what a high-value health system is. Health systems are situated in an ever-changing context where the demographics, epidemiology, political environment, legal and regulatory setting, economic environment, sociocultural norms and expectations, ecological environment, as well as technological contexts are changing. All of these changes influence the health system. They influence the trajectory and the performance of health systems. And as policymakers, there are three functions where one can intervene. One can improve the governance and organization of health systems at macro level. One can modify financing, how systems are financed, how providers are paid, for example. And third, one can modify the way resources are generated and they're applied. And these functions are then used to create a set of outputs in the health system, namely public health services and personal health services. And as policymakers, we want to ensure that these outputs are effective, they're delivered efficiently, they're equitable, and they're responsive to expectations of citizens and also to the changing context. And a high-value health system is one that produces outputs that are highly effective and efficient, thereby creating value for money, but also outputs that are equitable and responsive, thereby creating value for many. And in turn, these outputs help to generate a set of system outcomes, namely improve health, financial protection, and user satisfaction. But health systems are facing convergence of multiple contextual shifts. There's a perfect storm. For example, demographics in many high-income countries are such that population is aging very rapidly. In many low-income countries, population is rising very rapidly. Epidemiology is changing with increasing chronic illness and multimorbidity. Political uncertainty is a challenge for many countries around the world. Many legal and regulatory changes in relation to data, for example, are influencing health systems. And of course, many countries are facing high levels of debt and slow economic growth that is resulting in fiscal constraints to invest in health systems. And socioculturally, we are seeing increasing polarization among populations with strong resistance against science and evidence in many quarters. Of course, ecologically, climate change is leading to huge adverse effects on health systems, but technologically, there's a renaissance in technology. So there's a great opportunity to harness these scientific advances, such as data science, AI, computing, as well as improvements in diagnostics, therapeutics, other health technologies, in order to improve health system outputs and health system outcomes. But health systems are failing to respond to these contextual shifts. Many studies that we've been doing have shown that management of common conditions, such as diabetes or high blood pressure, again, using individual level data from nationally representative surveys, one is able to ascertain what proportion of the population has hypertension or diabetes, what proportion are screened or have their blood pressure or blood glucose levels or HbA1c levels measured, what proportion are diagnosed, what proportion are aware of their diagnosis, what proportion are treated, and what proportion achieve controls. So looking at this cascade of care, what we're seeing is that on the whole, in low and middle income countries, effectiveness levels are around 20 to 30%. Very low effectiveness in achieving control for these two major conditions, two major chronic conditions. Inefficiency is also a challenge. Many countries, although they're spending more on healthcare, they're not achieving, as this figure shows, many countries are achieving well below what is expected of countries that are similarly situated. Here, the figure shows on the x-axis per capita income. Each dot is a country, and on the y-axis, we have proportional population with diabetes or hypertension in this case that are adequately controlled. As you can see, most countries, with the exception of in low-income countries, are well below 40%, with the exception of Costa Rica, who is a high performer. But many countries that that have higher per capita income and spend and invest more in health are underachieving relative to their investments. So there's macro level inefficiency. What we also see in high income countries is that in spite of increasing expenditures, with COVID-19, systems were not able to respond. They were not resilient. And there is an increased number of excess deaths and a decline in life expectancy. But many countries have struggled to reverse that trend. And a country such as the US that spends more than any other country in the world per capita on health, the life expectancy has been in decline since 2014, 2015, accentuated and accelerated with COVID-19 without any recovery happening at the moment. There are also inequities. If we look at cascade of care, again, this is a paper led by Dorit Steen as part of her PhD. What she was able to show is that in low middle income and upper middle income countries, individuals with lower levels of education and in lower wealth quintiles do worse at every step of the care cascade compared to individuals that have higher levels of education and or are in higher wealth quintiles. There's also inadequate responsiveness. Looking at the achievement of WHO targets of universal health coverage, we're not on track to achieving the targets that WHO have set. And we have a shortage of 13 million health workers in low and middle income countries. So major challenges faced by health systems with inability to respond to these contextual shifts. The question is, why? Well, I think there are two major reasons. First, there's an innovation misalignment. We've seen major scientific developments, a renaissance in science that has led to unprecedented delivery of innovations, new diagnostics, new therapeutics, new vaccines, new health technologies. But innovation and delivery on the care delivery side has not happened. So on the one hand, we have delivery of innovations coming into health systems that are broken, with little innovation and delivery, with many health systems still retaining structures that go back centuries. This is a picture of one of the oldest the oldest hospital in the world that was actually built in the 7th century. So there's a major challenge in innovation and delivery. The second major innovation challenge is the institutional logic. We are captured by broken health systems. And Einstein said insanity is doing the same thing over and over again, but expecting different results. But Einstein also said that we cannot solve our problems with the same thinking we used when we created them. So we need to completely rethink to redesign health systems. And this is where AI can come in to change this institutional logic to help us redesign health systems. And this is possible now because there are major scientific advances that are enabling rapid growth of AI solutions. We're transitioning very rapidly from analog to digital data with data science and massive computational power. We're transitioning from generalized solutions to highly personalized interventions at individual and population level. We are moving from purely human delivered care or activities with augmenting that with soft learning, automated agentic systems. And we're transitioning from the traditional approach of using diagnostics and treatment to AI-enabled multimodal integrated solutions. So AI can help create high-value health systems so that health system performance, which is currently very low, with high variability, can be improved with improved performance levels, but also with reduction of the high variation that exists. And AI can enable us to do that. But the question is, how? Well, there's emerging evidence of benefits of AI in low and middle-income country settings, in addition to high-income country settings. So, for example, in addressing the major efficiency challenge that I mentioned, we're seeing evidence of effective substitution and productivity benefits. For example, in one study in a low-income country, AI provided consistent cardiovascular disease diagnosis in greater than 90% of cases, reducing reliance on physicians. And there was productivity improvement with community health workers using AI tools that helped to increase patient coverage by 25% daily. In a middle-income country, in a study, AI replaced ophthalmologist screening in rural areas, and this helped to increase the screening capacity by 30% with no specialists needed. In another study, AI helped to interpret, or AI-based solutions helped to interpret chest X-rays, and this helped to reduce the radiologist's workload, cutting reading time by 33% and boosting throughput by 20%. There's also evidence emerging on the effectiveness of care through AI. For example, in one study in a low-income country, there was improved patient adherence to treatment by 15% via automated reminders. In a middle-income country, one study, there was improved diagnostic accuracy by 15%, reducing stroke mortality by 10%. And in a further study, enhanced triage accuracy improved by 20%, decreasing intensive care unit wait times by 18%. So good evidence emerging on substitution effects to address the health workforce shortage issues, improving productivity, but also improving effectiveness. So where is AI being currently applied? And this is important for you to think as you enter the hackathon. Well, there are many solutions happening at departmental level. We're seeing evidence of solutions that help to increase administrative automation with augmented analytics and decision support, transitioning to development of predictive analytics and use of AI-enabled care pathways that enable management of larger number of patients than what a nurse or a physician assistant or a physician or another health worker might be able to manage. We're also seeing institutional level solutions, for example, a hospital or a primary care level. So we're seeing solutions that helps to optimize capacity, making better use of available resources. We're seeing, again, solutions that helps to automate processes. Again, application of predictive analytics for decision support and increasing use of AI-augmented care pathways. But at system level, the solutions are far and few. And as a system, one can think about a network of primary care centers or a network or a hospital plus primary care and community-based care or care at home or a national level health system here in relation to solutions aimed at improving health system performance, providing public health intelligence and population level health interventions. Solutions are far and few. And at global level, there's a big gap in developing AI-enabled solutions to help improve system readiness, system responsiveness, and system resilience. So there are opportunities. There's been sharp increase in the number of solutions available in the last 2 years, but system level and global solutions are still lacking. Hence, there's a major opportunity. So AI can help shape health systems and help build high-value health systems to improve effectiveness and efficiency of the outputs produced, but also ensuring more equitable use of these outputs and improving responsiveness to create value for money and value for many to enable health for all. So thank you for joining the hackathon and good luck in the competition.